Breast cancer, causes, risk factors, and prevention strategies. Breast cancer is a complex and multifaceted disease that affects millions of individuals globally. It is the second most common cancer diagnosed in women, after skin cancer, and can also occur in men. The causes of breast cancer are diverse and involve a combination of genetic, environmental, hormonal, and lifestyle factors. Understanding these causes and risk factors is crucial for early detection, prevention, and effective management of this disease. Genetic factors. Mutations in specific genes can significantly increase the risk of developing breast cancer. The most well-known genes associated with breast cancer susceptibility are BRCA1 and BRCA2. Mutations in these genes are inherited and can greatly elevate the risk of both breast and ovarian cancers. Genetic testing can identify these mutations, allowing individuals to make informed decisions about their health management. Hormonal influences. Hormones play a pivotal role in breast cancer development. Estrogen, a hormone that regulates the female reproductive system, can promote the growth of certain types of breast tumors. Early menstruation, late menopause, and hormone replacement therapy, HRT, are factors that can lead to prolonged exposure to estrogen, increasing the risk of breast cancer. Similarly, some breast cancers express hormone receptors, estrogen or progesterone receptors, making them more responsive to hormonal signals. Reproductive history. Factors related to a woman's reproductive history can impact her breast cancer risk. Women who have never been pregnant or who had their first pregnancy after the age of May 30 face a higher risk. Conversely, early pregnancies and breastfeeding can have a protective effect against breast cancer, likely due to hormonal and physiological changes. Family history and genetics. A family history of breast cancer can elevate an individual's risk. While BRCA1 and BRCA2 mutations are well-known examples, other genetic mutations and patterns of inheritance can also contribute to breast cancer risk. If a first-degree relative, parent, sibling, child, has had breast cancer, the risk is higher, especially if the diagnosis occurred at a young age. Lifestyle factors. Unhealthy lifestyle choices can increase the likelihood of developing breast cancer. Obesity, lack of physical activity, excessive alcohol consumption, and a diet high in processed foods and saturated fats are associated with an elevated risk. Maintaining a healthy weight, engaging in regular exercise, limiting alcohol intake, and adopting a balanced diet rich in fruits, vegetables, and whole grains can help reduce the risk of breast cancer. Environmental exposures. Exposure to certain environmental factors and chemicals may contribute to breast cancer development. Endocrine-disrupting chemicals, such as those found in some plastics and pesticides, have been linked to hormonal imbalances that can increase the risk of breast cancer. Avoiding exposure to these substances whenever possible is recommended. Radiation exposure. High doses of radiation, particularly during adolescence and early adulthood, can increase the risk of breast cancer. This risk is more relevant for individuals who have undergone radiation therapy as part of their treatment for other conditions, such as Hodgkin's lymphoma. Preventive measures. Taking steps to reduce breast cancer risk is essential. Regular self-exams and clinical breast exams can aid in early detection. Mammograms, especially for women over 40 or those with a family history of breast cancer, are crucial for early diagnosis. Genetic testing, when indicated, can provide valuable information for risk assessment and management decisions. Engaging in a healthy lifestyle, maintaining a balanced diet, staying physically active, limiting alcohol consumption, and avoiding smoking are all effective ways to reduce breast cancer risk. For individuals with a strong family history or known genetic mutations, proactive measures, such as increased surveillance, chemoprevention, or even prophylactic surgery may be recommended. In conclusion, breast cancer arises from a complex interplay of genetic, hormonal, environmental, and lifestyle factors. While some of these factors are beyond individual control, adopting a healthy lifestyle and being vigilant about regular screenings and exams can significantly reduce the risk of developing breast cancer. Advances in research continue to improve our understanding of breast cancer causation, offering hope for more targeted prevention and treatment strategies in the future.